A hearty good afternoon and welcome to the session on what is intrauterine insemination, its procedure and its success rate. We are glad to have Dr. Meenal Chidgupkar here among us today to help us understand the topic. She will take us through that and more in this session today. Doctor, you have the stage.
Namaste. Hello, I am Dr. Meenal Chidgupkar, Senior IVF Consultant, Apollo Fertility, Solapur. Today we are going to discuss about intrauterine insemination and what's its success rate and how it is to be done. Usually, when patients come to us for infertility evaluation, we give them a variety of different approaches towards their infertility treatment. So whenever couple comes to us, we have to see their all investigations, their history, their previous treatment approaches, and then we come to certain conclusions that which treatment modality is suitable for them. So, whenever patient comes with ovulatory disorders, like in cases of PCOS, when the follicles are not developing at the time of mid-cycle, that is, ovulation is not occurring properly. In those cases, then in cases of cervical factors, unexplained infertility, and mild to moderate male factors, and first, second degrees of endometriosis, we usually give options of intrauterine insemination to the patients. But we have to see what was the previous treatment modalities they have gone through. So whenever patient comes, they usually asks us how you decide about in whom we can go for intrauterine insemination and for whom we have to go for the test tube baby or other methods. So intrauterine insemination is usually done when the couple is married, like within 6 years of marriage. Then if there is ovulatory problem, cervical problem, as I discussed, unexplained infertility, endometriosis, or mild to moderate male factor. And in those cases, and the age of the patient also. If the age of any of male or female is less than 35 years, we usually give them the first method as infertility treatment is intrauterine insemination, where the patient has given ovulogens to develop the follicles, and at the time of rupture of follicles, the sperm of male husband or donor, when there is a azoospermia case or the severe cases of male factor where IVF is not performed, in those cases this donor IUI can also be used. So these things are explained when couple comes to us. They are started from the day 2 of cycles. They have given ovulogens. Sometimes in certain resistant cases, when with only oral medications the follicles are not developing, they can be started with gonadotropin injections also, and then the treatment is done. The basic concept for this intrauterine insemination is we have to increase the development of follicles more than one, so the chances of having the success becomes more. So various studies have discussed what is the difference between this natural method like ovulation induction and timed intercourse and this IUI, how much difference it has. So in various studies, Cochrane reviews, it has been observed that this intrauterine insemination has given more than 3 times success rate than this normal ovulation induction and timed intercourse. But still, the success rate of this intrauterine insemination, maximum it goes up to 15 to 20% in young couples, and when the infertility period is usually less than 5 to 6 years. So, whenever we advise these methods to patients, we have to make them understand what is the chances they are getting going to get pregnant in clearly. Also, when the age increases, it goes beyond 35 years or 40 years, the success rate drops down and it reaches up to 5% more than 40 years. So after 40 years, doing IUI will not give any much results. Intrauterine insemination requires monitoring when it is done with the gonadotropins. So the extensive monitoring is done when gonadotropins are involved. The involvement of these injections also is in a different protocols. The doctor will decide the protocols according to the patient's clinical scenarios. If the patient is a polycystic ovarian syndrome, then the treatment protocol will change. If it is a male factor, then treatment protocol will change. Various studies have done to find out, to see whether this natural cycle IUI is better or the stimulated cycle IUI is better. The conclusive results are not yet found, but still it has been proven that with the ovulation induction and IUI, the success rate definitely increases. In cases of endometriosis also, when we have seen before going to IVF methodologies, we can try this IUI methods, and if the success happens in these simpler methods, it is always better for the patients. So all these various uh, advances which are happening in infertility protocols, even IUI is having its advancements, and we are all centers of Apollo are trying to give best to patient irrespective of like which IVF method to be used. We are going step by step with the ovulation induction with IUI, and then we are going towards the test tube babies. So in these scenarios in our center also, there are so many patients who have like got pregnant with this basic, and the first step towards the infertility treatment, that is IUI. In IUI cases, there are few disadvantages. So in this procedure, we are trying to increase the ovulation. So sometimes there is a chance of developing more than two follicles in this process, and there is a chance of multiple pregnancy. So in certain cases, when there are multiple follicles are developing, and then we have doctor has to take a call why this IUI with gonadotropins or this ovulogens needs constant and regular checking with the ultrasound, is to understand how many follicles are developing, and accordingly we have to decide the further plans. If multiple follicles are developing, there is a chance of developing multiple pregnancies, and if more than four follicles are developing, we usually abandon the cycle, because if more like pregnancies happen, then it is very difficult, because we are aiming only singleton or the twin pregnancies. There is another chance that in cases of this IUI, when the more follicles are developing, in certain cases there can be a premature LH surge, means prematurely the follicles can rupture before, even before the IUI. And usually when follicle ruptures and a similar time zone, if the semen is introduced, then there is a higher chance that there is a development of pregnancy. But if it is prematurely ruptured and the IUI is done later, then to avoid that, we also follow a method that we check on LH kit that if LH surge has happened or not, and then accordingly we decide if the single IUI or double IUI is to be done. Usually, double IUI we used to prefer in cases of donor IUIs where uh, there is no later on any chance of any intercourse during that cycle and development of pregnancy. So we have to be very sure that the donor semen reaches uterus at the exact time of the ovulation. So those methods also are very important. Post IUI, we usually give uh, progesterone support to the patients to avoid any luteal phase defects and further pregnancy loss because of that. So, luteal phase support is very important in cases of IUI. Also, there are different ovulogens which are there in infertility scenarios such as clomiphene citrate or letrozole. In clomiphene citrate, in the earlier days, the endometrial thickness which we usually see is reducing because it is anti-estrogenic at uh, uterus level, endometrium level. So a newer drug, letrozole, came, and that was preferred by many of the doctors for this IUI method. For the preparation of the semen sample, when we take patients for the IUI, is very important, and there are various methods the embryologist or andrologist which follow, such as swim up method when there is very mild male factor or other female factor, the male factor is not there and good sperms are there. Double density in cases of the male factor problems, then we have to check we have to do a proper semen analysis prior to deciding this IUI. And also one very important thing is we have to check the tubal patency before we go ahead and do the IUI. So tubal patency is checked initially with a very simpler method, that is HSG, where only tubes patent or not, and the size, like overall uh, uterine structure we can able to understand with HSG, and that gives us uh, a very positive way to go ahead with the IUI. So in women, after the investigations, after the ultrasound, we do HST, and for men, we have to do semen analysis and understand if there is any other problem like morphological problem or like infections present. Then if we suspect any infections, pus cells, then we have to go ahead and do semen culture to understand what are the microorganisms involved, and accordingly treatment has to be given to the patient beforehand when we start this IUI. For to have the maximum success, we have to follow all these protocols, and then we have to go further and do the IUI procedure. So after understanding the semen analysis, we can give antibiotics, or to increase the motility we have to give certain drugs. If the patient is having tobacco or alcohol or cigarette smoking issues, we have to tell them, we have to ask them to reduce all those things, because that directly affect the semen quality. If they have any occupational hazards regarding that, we have to inform them about that. Various surgeries, if previously happened in pelvic area or irradiation has done, we have to take the complete history of all that things, and we have to go ahead with the IUI procedure. IUI procedure is basically simple. It is with speculum, we have to see the vaginal structures, the cervix has to be held sometimes to straighten the canal, or with the cuscos it can be fixed, and then the IUI catheter can be introduced inside, and the sample up around zero point 0.5 ml, or some sample is introduced, semen sample, at in the just uh, just lower down the fundus. So for the process of implantation and fertilization can happen. Fertilization can happen in the tubes, and then it will recede down to the endometrium in the intrauterine cavity, and implantation can occur. So usually we ask the patients to see if their natural cycle like periods come or not. If the periods are not coming after 3-4 days, we ask them to follow up with us with the UPT results, or sometimes beta HCG, to see what is the further further result of that IUI. Usually, there's a question by all the patients is how many times we can do this IUI. So yeah, previously when IUI was the easier, and even at the nursery level, it can be done. Clinical levels it can be done, but now for the IUI also we need step 1 registration at ART. So IUIs were done multiple times, and uh, because of that, when the patient used to come to us, to 6 IUIs done, 7 IUIs done, so usually patient asks us how many minimum IUI we have to do. So generally we restrict IUI up to 3 to 4 IUI, not more than that, because to start only the IUI has to be done 2 times to maximum, to get the maximum results, and if required the third time, not more than that, then we have to decide for the further method of infertility. So in this 2 IUIs, the cumulative pregnancy rate is more, so we have to uh, usually stick to that protocol. And we at our Solapur center gives maximum 3 to 4 IUI attempts for the patients, and then we advise them for the further infertility treatment. So in this IUI scenario, I think most of the couples have a lot of questions regarding that, how it happens, what exactly happens. That we tell them at all our counseling sessions, clinical counseling sessions, so they understand it thoroughly about which procedure they are going to follow. And basically, while undergoing this IUI, in mind we have to understand that 15% success rate is exactly what, when 100 people we are treating, the 15 people are going to get pregnant. So this way the patient exactly understand what is the probability that the couple is going to get pregnant. So thank you very much for attending this session. This session I wanted to give you the clear idea about this intrauterine insemination, and if you have any doubts regarding that, definitely you can ask here, or you can go and check this Apollo Fertility Solapur website, and you can ask uh, us any questions. Thank you.